This is a psychosomatic medicine study, again from 2007, and it's titled The Low Dose Dexamethasone Suppression Test in Fibromyalgia. And I'll preface this whole thing by letting you know that this test is very specific to Cushing syndrome or Cushing disease. It's giving you a steroid that is supposed to suppress your cortisol. It's supposed to do that. And if it doesn't suppress very much, it's one of the diagnostic criteria or testing for Cushing's syndrome or Cushing's disease. So that's a little background. Okay, so they do. I'll just begin reading. Fibromyalgia patients is associated with decreased cortisol secretion. Patients with post-traumatic stress disorder exhibit similar hypocortisolism in the context of increased negative feedback sensitivity of the HPA axis. Because trauma and PTSD have been associated with fibromyalgia, we evaluated whether patients with fibromyalgia demonstrated increased HPA feedback sensitivity. So they're going in this with thinking that PTSD could be causing it. And I suppose it could, but they're testing them for Cushing's. I just want a heads up on that. They tested 15 females and 20 normal controls, and they go through the process of how the dexamethasone suppression test is conducted. Totally agree on that. The process. They do a baseline. You take the dexamethasone, which is a steroid, at 11 p.m., and then retest your hormones in the morning. They tested the ACTH and cortisol. This is totally consistent with a Cushing's test. And the results were patients with fibromyalgia exhibit more pronounced suppression of cortisol, but not of the ACTH. And they get into the ratios and that. And they make a sort of a conclusion. This is associated with stress and anxiety. And their conclusion is suggest an increased sensitivity to cortisol feedback manifest at the adrenal level in fibromyalgia. Well, again, I ask a lot of questions. If they're testing for Cushing's, they're not testing for if there's a low activity of the adrenals. So, come on, you guys. This study goes back to 2008. And it may very be the most egregious of them all, and I'll tell you why. And it asks, is there an association between fibromyalgia and below normal levels of urinary cortisol? And the answer is yes. There was a significantly lower urinary cortisol levels than healthy women. And a part of their conclusion states, abnormalities are not generally detected in laboratory tests unless the patient is being tested for another illness. Well, the point being is that you need to test. And they go on to say factors that contribute to the development or perpetuation of fibromyalgia include endocrine alterations. Studies have demonstrated a latent decrease in the levels of certain hormones. I'm going to stop right there. A latent decrease. Latent means, not seen. It's not hidden. And the point being, it's not latent once you test, okay? Start testing. Um, and it's talking about growth hormone, prolactin, and adrenocorticotropic hormone. That's ACTH for short, and cortisol. Three of three of these are pituitary hormones, and they have a decreased level. This is very indicative of a pituitary not functioning properly. It's called hypopituitarism. And the fourth hormone is cortisol. And the ACTH, the adrenocorticotropic hormone, messages the adrenals to make cortisol. So that's why the cortisol is low. I maybe shouldn't, I don't know, I feel apologetic for getting excited about this. But what is wrong with them? It's not latent, this is not a latent illness. They're demonstrating it. And where is rheumatology and endocrinology getting on this? There are more current studies out there, but they're all regurgitating the same thing. Out of curiosity, I did ask my endocrinologist at one of my visits, as I've been looking into this. I asked him, do you have people coming in or getting sent to you that have fibromyalgia or chronic fatigue? And he stated yes. So there is help out there, good endocrinologists and good doctors that recognize that there could be something going on with the endocrine system. And God bless all of you. I know this doesn't apply to everyone, but there are issues, that are not fully being addressed. And the bottom line is, in studies they have a N equals. We are all N equals 1. We require our own studies and a really thorough endocrine workup if that is appropriate for your care. Okay, thank you so much for listening.